Namaste and welcome to another episode on Sarva Gunn Sampann. I have with me today somebody for whom an experience of compassion, humility, and sincerity is all that she needs to lift her spirits on any given day. It is also a pointer to her for self-development and growth. Her biggest strength is perseverance. Please join me in welcoming Dr. Ekta Saroha. Ekta, I'm so honored and happy to see you on Sarva Gunn Sampann. Welcome.
Thank you. Same here, Anu. Thank you so much.
We'll get started with our first segment, which is all about your childhood. So please go ahead and share your story.
Okay. Thank you, Anu. And before I begin, a big thanks to Sarva Gunn Sampann for launching this platform where we can build a community that inspires and encourages. It is very, very unique. So congratulations on that. And I'm very happy to be here and to contribute in whatever way I can. So thanks for the gracious invitation. It is an honor for me. Thank you. So in terms of Bachchpan ke din, what I would like to mention over here is that the schooling that I received, so I went to Kendriya Vidyalaya, which is the central school. So these schools are for the kids whose parents work for the central government. One thing that is very much appreciated and valued over here is that in Kendriya Vidyalaya, we get a very unique opportunity to experience diversity. So imagine like somebody like me from a Hindi belt, I could parrot the Pillalara's Telugu song during our morning assembly. So today when I sit back and think about that song, then I'm like, oh, so it was a Telugu song. And we didn't even know what we were singing, but we were singing. So that kind of diversity that I experienced at Kendriya Vidyalaya has been very precious to me. So I think our school was a proverbial melting pot. And each day in the formative years of my life at school, I could toy with the diverse lifestyles, cultures, languages, religion, caste, class, things that were very different from my own. And my preconceived, flawed notions of superior, inferior, divine, evil, good, bad, I think those got fizzled out bit by bit. So I think such exposure are instrumental in inculcating tolerance and respect for multiplicity, which I value a lot, and which I think is a great learning that every individual should experience. The home environment which we experienced, because my dad being in central government, so we lived in central government housing, which was in R.K. Puram. So R.K. Puram, again, it was like people from all over the country, from Tamil Nadu, from Andhra, Rajasthan, Punjab, you name it. So early on, we got an exposure into different foods from different, like idli, dosa, and all that, which we would not get to experience if we would have grown up in a small town, which was more homogeneous in nature. So this exposure of growing up with kids from different backgrounds is something that I valued a lot. And at home, again, so my parents always encouraged us to go out and explore. There were never ever any restrictions on, don't be friends with this one, don't be friends with that one. So that kind of liberty was very precious. I really value it.
All right, Ekta. We will move on to our next segment, which is Ye Kahaan Aa Gaye Hum. And this is, after your schooling was done, what kind of education did you receive? What was your pathway? So please talk to us all about what you did after your schooling.
Yeah, so in terms of education, so I was in Kendriya Vidyalaya from class 1 to class 12, through and through, along with you. So we became best buddies for 12 years, and then we moved to different paths. So I then moved to Miranda House for my bachelor's in geography, and just because I had scored well in geography, so that made it an obvious choice to go for bachelor's in geography. Then after completing my bachelor's, again I was lost. I didn't know what I was doing, and thankfully I had my elder sister who was guiding me, and she suggested that I do a master's in social work. So I was at Jamia doing my master's in social work. So things were happening to me, and I think it took me a long time to keep exploring. So I kept on exploring, and I kept on uh, finding out what are the options that are out there. And in those days, in 1990s, career counseling was pretty much unheard of. And the attitude was that get a degree, and if you can find a job, great. If you can't find a job, then, and especially for students who were not extraordinarily bright in either science, like engineering or medicine. So I was a very mediocre student, very average one in school and even in college. I think I would take a good amount of time to understand and comprehend all these complex sciences and whatever. So I took my sweet time. So, but after completing my master's, I started working, and at that time, it was 1995. That was the time of HIV, and all the jobs were in HIV only. So whether I liked it or not, I was doing HIV work. And during the job, I learned a lot. I learned a lot about health. I learned a lot about social development and preventive health, public health, and things like that. And late in life, I gathered the courage to take the giant leap in my education and career. And the credit goes to my mentor and my supervisor, Dr. Lynn Sibley. She is a professor at Emory University. So at work, she started very patiently guiding me to identify a doctoral program, a university, a thesis, and all the nitty-gritties of grad school in the US. I was very, very hesitant. I didn't have any confidence, but thanks to her that, she kept on encouraging me to at least give it a try. So I made it to the grad school, to the University of Alabama in Birmingham. And over there, again, I was fortunate enough to receive my mentorship and guidance from Dr. Maya Altrats. So she is a professor at the UAB School of Public Health. And whatever I know today in epidemiology or biostatistics, it is because of her. She painstakingly taught me each and everything. It was literally like, haath pakad karke likhna sikhaya kind of scenario. So because I was coming from social science background, and then I was in this health sciences background, so it was an uphill task for me to learn all that. And it was a great learning experience. Lots of challenges, lots of hardships, but in hindsight, I'm glad I did it. That kind of experience, I think everybody should go through, so that it helps you understand your strengths, also your weaknesses, and your potential. So I moved to Birmingham in 2002 on a shoestring budget. And it was my first time on a foreign land, with limited understanding of grad school, the doctoral studies, the culture of Alabama, and on top of that, independent living. So I am embarrassed to mention that at the age of 27, I was still struggling with being on my own. So the experience of moving to the US to the grad school was very enlightening, I would say, because there were a lot of instances wherein I was not able to help myself. And I must say that if I approached 100 people for help, 101 made themselves available. They went out of their way to help me out. So I owe a lot to each and every one. If I would start naming them, it would take up all the time in this show. But I think it is, I really am very, very grateful, and I would like to express my gratitude to each one American, non-American, Indian, from various races, from various countries. And today, I feel that how is it that I can pay back? So I think that I can repeat those acts of kindness on every available opportunity, and that's what I try to do. So that if I see a student who wants to go for higher studies either in India or abroad, I try my best to guide them in every possible way, so that it will become a little easy for them. All the scenarios have changed over the years, things are very different. Now people can Google and people can find help on WhatsApp, but still, like, whatever, I think I can tell them, even in terms of, carry an umbrella, because if you are going in August, it would be raining and all those things. So that's how I try to reciprocate. And one learning that I would like to mention is that early on in life, if we acquire basic skills, very basic, such as cooking, laundry, driving, managing your money. So I will be honest, I didn't know any of these. And if we know all these things, how it helps, that it spares room to explore new things and to take on bigger challenges. If you're struggling in your spare time just to, fix a meal for yourself, there is a lot that is going out in the world that you're missing out on. So if you learn these things early on, then when you are a grown up and you are independent and you can go out and explore the city, that's where you would be able to find time. So I could see my friends who were from other countries, they will do their things so quickly and they will be going out for concerts and whatnot, whereas I would be sitting at home and just doing the basics. So yeah, so those were the struggles when I reflect on, and then I feel that we need to prepare our kids in every possible way.
In all the things that we achieve in life, the basic foundation is laid on self-sufficiency, and those are those life skills that need to be inculcated early on. You mentioning that, I think it's wonderful, because you've achieved so much, but for you to say that that is where you start, that is the starting point, I think that's really great. All right, Ekta. So what happened after you finished your PhD, and then what course did life take?
Yeah, so it took me 5 years to complete my PhD, and I take pride in saying that, because only after joining the doctoral program, I learned that the doctoral program is all about learning the nitty-gritties of science and research. It's not about doing any groundbreaking work or research. It's about learning the process of science, the methods of science. So I value that a lot, that I could spend good amount of time in learning all that. And then after completing that, I came back to India, and I again started working in the HIV domain. So the skills and the in terms of, like, advancement in career that I received with my doctoral degree was that yeah, my job profile was now bigger and a better one, and not only in terms of the titles but also in terms of money. And in terms of skills, I now had a better understanding of science and research. So I felt more confident about what I can do and what I must do in this domain of public health. So that was a very valuable learning. And I did. So I came back and then I started working again in the HIV domain. So this time when I was back, I was now training the people who do counseling for people who are either at risk of HIV or who are infected with HIV. So we were training the counselors in doing HIV counseling. And then I also worked on something called the health management information system. So every country has these big information systems wherein health data are captured, stored, analyzed, and then we generate reports out of that. So I closely worked with the Ministry of Health here in India, and it is easier said than done to have a health management database that can do what you want it to do. Then I worked with, I don't know if these names will resonate with you, because people from non-health background, I don't think, are very familiar with all this. But there is the USAID, which is the United States Agency for International Development. And then there is the US CDC, the US Center for Disease Control. So I worked with these, and these agencies are across the globe. And their portfolio is that they assist countries like India in strengthening the health system, which basically means that if Ministry of Health has some programs going on, then we will be providing them technical support in doing it in bigger and better way. So had a very good learning experience with these organizations. And when we do this, when we are helping the Ministry of Health with the development of the health system, there are multiple activities that are carried out. One of the activity that we do is that we train the health workforce in India in doing different kind of things. For example, patient care, or managing the health data, or investigating a disease outbreak, which is called epidemic or pandemic. So COVID is one example. So when something like COVID happens at a small level, for example, in a village, then what do you do? How do you manage it? How do you control it? So we would train people in doing that. And so I've been doing this public health work for 25 years now here in India. And now I'm at the International Institute of Health Management Research in Delhi.
Yeah, and we'll come to that. We'll talk about that in your Kaam Ki Baat, because I can't wait to hear all about that. But I also know that you work for the World Health Organization, right? So talk a little bit about that as well.
Yeah, so there is something called neglected tropical diseases. So there are a handful of diseases which are prevalent across the globe. And in Africa and Asia, the prevalence is pretty high. And these neglected tropical diseases, the term itself indicates that there isn't much that is being done for the prevention and control of diseases. And when we say much not being done, it would be in terms of money, that the governments are not putting in enough money. Even the international organizations such as WHO and UN are not putting enough money into these. And also in terms of that, we are not keeping a track of where we are with the elimination of these diseases. So there is one disease called visceral leishmaniasis, and the local name for this disease is Kala Azar. So this one is pretty, we have a large number of cases of this disease in UP, Bihar, and in the neighboring countries of Nepal and Bangladesh. So there is a commitment from all the governments in these countries to eliminate this disease. But elimination is easier said than done. It takes a lot to eliminate a disease. So my job at WHO and prior to that with Crown Agents was again to support, to provide technical support in figuring out policies, programs, priorities that should be taken up to speed up the work of elimination. And it's just not me. There are thousands of people who are working on this agenda, but everybody has to do their bit so that we can move a step further. And these things require not just technical expertise, but also diplomacy, political commitment, going back to the government again and again, finding resources, going to the funders, big funders like BMGF, the Bill and Melinda Gates Foundation, the USAID. So there is a lot of action that goes on before we can see some big announcement like a polio announcement that, hey, we are done with polio. So people keep working towards it. So now Western leishmaniasis is one disease which is on the agenda, along with there are like leprosy is also on the agenda. So the government is making sincere efforts to eliminate these diseases and lower the disease burden.
You are now teaching. You are a faculty at IIHMR. Okay,
Yeah.
so how is that work? Have you seen an uptick in interest, for students, especially post-COVID? Do you think that there's more interest in the field, and now people are also developing greater awareness?
You're very right. You're very right that, COVID has been an eye opener for many of us, young professionals or senior professionals. And now we have a new perspective towards how we can, address these challenges and these needs of the healthcare system, of how to manage something like COVID. And COVID is like too big, but even if there is something like at a small scale, then what is it that we can do? What are the small things that needs to be in place before we can address a big challenge? So there is, because I have been teaching and training epidemiologists, people who are at the front line of managing an epidemic and responding to an epidemic. So yeah, post COVID, when I was working with the medical officers in India, at that time the awareness wasn't as high as I now see with the students who are in the master's program, who have limited exposure to the health system and the epidemics or disease surveillance. So even among them, there is more enthusiasm, and they are able to see what is it that they can do. So that makes my job a little easier now, because now I don't have to, give them hypothetical scenarios. Now, for every example, I'm like, remember what happened in COVID? So now let's, yeah.
How is it training this generation of young public health professionals? How's that experience?
It is very interesting, and I think I'm kind of, not saying it with so much enthusiasm, and I will tell you why. That the unfortunate thing is that the profession isn't as rewarding as an IT profession. So, the amount of work that goes in to do a job for an epidemiologist or a health manager or any public health professional, the amount of labor, the hard work that we people put in is very much at par with any IT person. But IT jobs are more rewarding financially, and also the growth that one can expect in terms of the position, the remuneration, and all those things. So that is very fast and very quick. Over here, we have to really convince our students and, give them a lot of moralistic talk that as a citizen of this country, it is your job to do something for your country, for something for your people. It isn't as lucrative a profession as the IT industry, or I cannot think of other examples other than IT, which is the best paying one today in India. So that's there. So that's there. But the other thing is that and within this public health, epidemiology, biostatistics, if now we would start talking about research, then research is very underpaid, and the amount of work, the attention to details, the repetitive things that one has to do, and one has to learn a lot. But you cannot just do research by completing your master's degree or even a doctoral degree. You have to keep on practicing it over and over again. And the research funds are very limited, the grants are very limited, very competitive. It takes a lot of hard work to secure one grant, and after you get it, you would be so exhausted that you would be like, oh goodness, I don't want it now. I cannot do it. So to convince our students to be interested in research and do something groundbreaking, something Nobel Prize worthy, is an uphill task. Again, the resources are limited for public health research in India. So most of the good research work that happens in the domain of public health again happens in the West. And most of our students are keen on making it to a US university where they can do some good research work. And to be honest, I did it for the same reason. So when I went to the US for my doctoral degree, I knew that over here the research experience that I would get, it's not going to be the same that I would get in India. So some of us come back, others don't, and we would not have that high quality of research work that we would like to have over here. So I wish there would be more money. It would, if it is more financially rewarding, then we will have many more big names in the health sector who would be who would become role models for the new generation.
Yeah. But I hope all of that starts to change, especially I'm sure that COVID has highlighted a lot of those areas that require attention, by the government, by us as a society. So I hope we'll begin to see some more investment in this arena as far as research is concerned. And like you rightly pointed out that, those are very important initiatives, right?
Definitely.
What kind of backgrounds do your students come from? So if you have a cross section of students in your class, typically what kind of backgrounds are these students coming from?
Yeah, so the sentiment of public health is that this is a multidisciplinary science. It encourages people from all academic disciplines to come and join this work field, because public health is something that cannot happen in isolation. It is not medicine, it is the health for the people. So if you would see in the US, people who start with the Masters in Public Health, the MPH program, these people would be lawyers. These would be dentists. They would be social scientists, social workers, or even musicians. So the idea is to bring in people from various backgrounds so that we can have a team wherein we can, people can think through a problem and find solutions. For example, if the problem is that we need to encourage people to adhere to their HIV treatment, because HIV treatment adherence of 90% or more is something that can help you prevent the spread of the infection. Now this requires behavioral change. And where are the behavior change experts? They are in the social science domain. This requires that there should be some policies wherein people can get their medicines for free. So how are we going to get those medicines for free? There need to be policies around it that subsidize the price of this medicine and all that. So those are that's where we need people coming from different academic disciplines with different expertise. At IHMR, we have students who are coming from different backgrounds, and we have people who have done their bachelor's in dental surgery, the BDS students. We have MBBS physiotherapist. We also have people from commerce background, and we would also have from social sciences, but not that many. But yeah, biology, zoology, and science disciplines, different science disciplines. So they are the one who are able to see that there is a role for them if they do a master's in health domain.
Got it. So typically any background at the undergrad level, and then they can come and pursue a master's, at one of these institutes like yours. What is a typical pathway? So once somebody graduates, what is the progression in terms of a career? You said they're not starting out, making great money. It's not very lucrative and it takes a lot of time. But is there a typical pathway that one can pursue? Like, you start at a junior level and then you get to a more senior establishment.
Yes, there is one. So I would say that there are 4 types of employers that are out there. The first type of employer is the NGO, non-government organization. So these are the organizations that receive funds from various places to carry out one project or more than one project. It could be an immunization project, or it could be a project on reproductive health, or elderly care, or any topic which is a priority on the government of India's agenda. So these would be the NGO sector. The next will be the government sector. So in the government sector, there are very few positions that are available, and so a limited number of opportunities, and those opportunities also come kind of pretty late. They would usually prefer people with experience and a science background, along with a master's in public health. Then the third one would be what we call consultancy firms. So these consultancy firms could be Indian or they could be multinational. So these consultancy firms are the one who would hire our students at entry level, which would be something like project officer or a research assistant. And when in their first job, most of the times, what they would be doing is that they would be doing a reality check. For example, if there's going to be something about elderly care, so they will have to scan the web, they will have to find out information, what is the scope, what is going to happen, how much money is the government going to invest, where is the potential market, and things like that. And then the fourth one is the USAIDs, the WHOs, BMGF, the big ones, for which we prepare our students to, learn the basic skills, gain as much knowledge as they can, and then aim to try to get into these organizations maybe after 5 years, 10 years, but because that's where a lot of decision making happens. And we would like our students to be a part of decision making, because if they are part of decision making, only then we will be able to have leaders who are influential. So although we create worker bees to begin with, but eventually we want them to be the leader bees.
Okay. No, that's fascinating. I know it's a very time intensive process in terms of getting that education, the right type of research. But I think at the end of the day, if that's what you're passionate about, then you've got a great career ahead of you, right?
It is.
That's great information, Ekta, on the kind of work that you're doing, and I hope students who are interested in this field are able to gather some great information, insights about this, and that really helps them advance in their own careers. So thank you so much. We'll move on to our next section, which is about your X factor. I'd love to hear about, what are some of the things that the world doesn't know about you.
Yeah, so the X factor is, this is something that the world knows about me, and I talk about it with a lot of love and passion. Both I and my husband, we try to do whatever we can for the animals which are on the streets in the community, which don't have a home. So sometime back, 8 years back, we adopted an Indian dog from an NGO, and Bantu. So he has been with us for about 8 years now, and he's adorable, the apple of our eye. And then whenever we get an opportunity, we will make financial donations to the animal shelters. And there are groups within our community, within our society, wherein we also pitch in money to do sterilization, vaccination, and even feeding of the dogs on the streets. Not just dogs, but cows, pigs. In India, you can find everything on the street. So whatever we can reach out to. So that's something that really makes us happy, and we feel that we are doing what a little bit that we can. And so for past couple of years, we haven't been able to do as much as we would like to, but we will compensate for it. Surely. So my personal financial goal is that I would like to donate an animal ambulance to one of the organizations that we have been in touch with for quite some time. So for that, need more money, need a bigger package. So working towards that.
Oh, that's awesome. And if you ever start a GoFundMe page, please be sure to share the link so that, all of us, some of us, anybody who's interested in supporting your cause is able to do so. That's
Oh,
fantastic.
that's a good idea. I didn't think
A
about
great
it.
place of empathy and passion and compassion, right?
Yeah.
So great to know about that. Anything else that you'd want to talk about in terms of your X factor? And let me rephrase that. It's not the world doesn't know about it. It's some of us that didn't know about that. So
So this is something that makes me happy when I'm around my dog, and I can do something for the animals. Other things that really make me happy would be if I can uh, read a book which is very thought provoking. And my husband says that you read all these sob stories. So I don't know if it is a good thing or bad thing, but I tell him that no, these are thought provoking, these are not sob stories. But yeah, I like to read things which I can relate to. If it is something which is coming from the northern part of India, and I can make a connection with the context and the scenario, then that excites me, and I'm able to make sense out of it. So that's something which is whenever I find time, I try to do that. And yeah, I love to travel. We love to travel, and the condition is that we will go to places where Bantu can go. So we will put him in a car and we will take him to wherever we can, to Jaisalmer. That was the recent trip, then to the hills. And he loves that. He hates car rides, but once we reach the destination, then he is very, very happy. He's very delighted to be in a open space where he can run and play.
he's one lucky pet. That's all I can think of.
We are lucky.
And now we're going to talk about what you do for your own self. You're doing so much for your students. You're taking care of your pet. You've got all these, causes that you're supporting. What do you do for yourself on a day-to-day basis to support your own physical, mental, emotional, and spiritual health?
I love to dance. I love to dance. Yeah. And the catch over here is that I don't know how to dance. So I'm still out of sync. My rhythm is off, but I love to dance. So what had happened was that 4 years back, I got diagnosed with diabetes. My sugar levels were very high, and I had put on a lot of weight. So the doctor said that every day you have to do half an hour exercise where you sweat it out. And then I toyed with different options: the gym, the treadmill, and the running and all. Everything was so boring, and it felt like a pain. I was like, I cannot do this, it is impossible. But then I found Zumba classes. I started doing the Zumba classes, and the Zumba classes that I have been to, those are not Zumba as such, but it's a dance workout. So we would dance to whatever song you would play. So we are a big group of girls who are very enthusiastic about staying in good health and taking care of ourselves. And I think the trigger is that dance makes me happy, music makes me happy, and during that happiness, if I'm sweating it out, then I just don't mind it. I in fact look forward to it. So every evening I would just pack my bag from office and I will rush home so that I can go to my dance workout. And people who have been very graciously teaching us are like my friends here in our community, and they have been doing it for free. So I'm so grateful to them. Because of them, I'm today, my sugar level is in control, my weight is in control, and those we spend about 1.5 hour every evening doing all this workout, and those 1.5 hours are the happiest minutes of my life. It's a stress reliever. It is something which calms me down. If I'm angry at something, during that 1.5 hour, I don't have any anger towards anyone because I'm so absorbed in the music and in the dance. So that is something which is very special to me, and I try my best to find time to do that because it keeps me sane, and it is very very important when you have multiple challenges and things going on in your life. That kind of sanity is very very important.
Who says workout has to be boring? You can be quite innovative. Like in your case, you figured out dancing is what's doing it for you, and now you're really enjoying it. So that's really unique. Ekta, any words for our audience before we part? Any final words?
Yeah, so thank you again. It was wonderful talking to you, and thank you for giving me an audience, because all the time I want to tell people, this is good, this isn't good. So this was my opportunity to do that. And what I would like to mention is that it this platform of Sarva Gunn Sampann, this isn't a small feat for us women to come together and to have a podcast wherein we can reflect and introspect, and we can broaden our view of the world. Uh, it might look like that, this is something that has been going on in other places as well. But this, I think, is very, very important, and it should be kept alive, and we all need to contribute to this, because when we are in isolation, there is a risk that we will lose the motivation, we will lose the encouragement and the foresight. And over here, what I would like to mention is that there is this book by Gayatri Bahadur. It is an Odyssey of Indenture. The title of the book is Schooly Woman. And when I say this, I think about the content in that book, wherein we could see that when women were functioning in isolation, how they could not, create an agency for themselves to put forward their needs and ask for their rights. So if we would have something like this, a Sarva Gunn Sampann kind of platform, at least we will come to learn the realities of one another, and we will be able to ease the transition into the future for the next generation. So this is, I think, it's a big initiative by you. Congratulations again, and it is something which is going to make a big dent in the society.
Those words from you mean a lot, Ekta. I think that for you to really put that perspective out there, that in isolation, no matter how, what we're achieving, how much we're achieving, or what we're able to do, if it's not highlighted, if it's not spotlighted, then there's no way others can benefit or learn out of that. And I think that's the message that should go out loud and clear, that let us all share our stories, let us put out there our experiences and our diverse perspectives, and learn from each other. And that is what I think increases the appreciation and understanding that we can have for one another. And so I really want to thank you saying those words. And on that note, Thank you for coming on Sarva Gunn Sampann. To my audience, please go ahead and subscribe to this channel so you can get all the information about amazing number of topics from my guests like Dr. Ekta Saroha. Ekta, thank you so much for coming.
Thank you, Anu. Bye-bye.
Bye-bye.
Thank